Good morning. We'll call the Kaneohe County Board of Commissioners meeting to order. First order of business is stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Well, good morning, everybody, and everybody who may be watching this. It's a rainy day, so you might be inside with nothing better to do but to watch the Board of Commissioners meeting today. So you're welcome. Thanks for being here, everybody. First item of business is to approve the agenda. I'd entertain a motion to approve the agenda.
So moved.
Commissioner Gardner moves on the agenda. Do I hear a second?
I'll second it.
Commissioner Dale Anderson seconds. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Next item is the consent agenda, and on the consent agenda is the Board of Commissioners minutes from the last meeting, the approval of the paying the bills, the warrants and claims, approval of human services bills, warrants and claims, cancellation of any services and warrants. In case anybody's wondering, that's bills that were checks written out to the wrong people or you couldn't find them or mistakes, whatever. They just have to cancel them. And then hosting agreements for Kaneohe County to host electronic data management system caseworks for counties of Aiken, Cook, Coochin, and Lake. We already do this for several other counties. It's fairly routine contract work, low budget kind of stuff, but it's mutually beneficial to both counties. So I would entertain a motion to approve the consent agenda.
Mr. Chair, you have item F as well, just below.
Oh, I'm sorry, thank you. Application for the Spicer Commercial Club for 4th of July events between July 4th and July 7th. Now I'll entertain a motion.
I'll make a motion, Mr. Chair.
Commissioner Dwayne Anderson
the
moves on the
consent
consent agenda.
Mr. Chair, I'll second that motion.
Commissioner Berg seconds. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. General business discussion updates, daycare consultation services. Denise Kragenberry and Constance Nelson. I don't see no. Okay. Good morning, Denise.
Good morning. My name is Denise Kragenbring. I'm one of the supervisors in Public Health. And I'm here today just to talk to you a little bit about what public health involvement we have in daycare providers. But I want to start out with just a big thank you to anybody that currently works in childcare as a provider or a worker in any aspect. National Child Care Provider Appreciation Day was actually May 10th, so it was within this last month. So it's appropriate that we talk about it today. Where's my button? There it is. All right. And I'm going to read this through too. It's another big thank you. Child care providers deserve a big thank you for their dedication, commitment, and compassion. Less than 1/3 of the children in America have a full-time stay-at-home parent. Since the child care provider is a partner in raising children, parents carefully choose their child care provider. It may be a private home daycare, a daycare center, an in-home provider, or a live-in nanny. Parents put their trust in their child care providers as they share child rearing responsibilities with them. So a little bit about our involvement in public health. We provide consultation to licensed daycare centers. Currently, we are providing that service to 4 daycare centers in our county: the Bright Light Head Start, Discovery Hill Child Care Center, Praise and Play Child Care Center, and Loving Arms Child Care Center. So a little bit about what that is, and I'm not going to read all of this, but there are statutes in Minnesota that the daycare centers have to abide by. There's 5 parts to it. Basically, they have to have written health policies. They have to have a consultant, which has to be an RN. They have to have and follow diaper changing procedures, and they have to have a first aid kit available and accessible within the center. And then the last one is they have to have procedures related to any kind of food preparation or food handling at the daycare center. So that's all in our Minnesota statutes. So we have a public health nurse that provides, like I said, consultation to those 4 daycare centers. So I'll just tell you a little bit about what that entails. But I do want to introduce Brandy. I'm going to have her just come up here and stand by me so that everybody can see. Brandy is one of our public health nurses. As you know, in public health, we wear lots of different hats, and one of the hats that she wears is that she is the daycare consultant for these 4 centers. So once a year, when she goes there, that's a more extensive visit where she will review all the policies, the health and safety and the sanitation policies, and make any recommendations that are needed from that. She's going to look at the establishment, I mean, walk around on site to see, if there's any health hazards. Maybe review and talk about reporting of communicable diseases and what that looks like. Provide any kind of special recommendations or specific recommendations if there's any children there with special health needs. Review the mandated reporting laws. Most of the people that work in childcare are well aware that they are mandated reporters. And ensure that all of their immunizations for the children that are there are up to date. And they're all really good. The staff at the centers are very good at recognizing that and keeping up with that as well. And then once a month, so that's the annual visit, but once a month, Brandy will go to each of these places too. And again, just review some first aid and safety, review the diapering procedures and practices, the sanitation, and then just talk about anything that they might be having any issues with or questions about. And she can connect them with resources and or, answer their questions. If there are any illness or injury logs, she can, take a look at that and advise accordingly on that as well. She's available to them by phone as well in between these monthly visits if they should have some questions and just need some consultation. So we're very appreciative of Brandy's work in that, and that pretty much covers what our activities are related to daycare. Is there any questions from you folks?
Any questions for staff on this? Go ahead.
Just more of a comment. I appreciate this update. Often we think of just childcare providers and we think in the licensing aspect of a period and one person in one department, but how everything overlaps so much and we're all kind of connected with our different agencies that we have within the county. So really a good update, and it really sounds like it's more not only checks on the providers, but also that you're there to work with them. And
Yeah.
you got that relationship and being supportive. And that's one of the things I think Steve and I hear, or Commissioner Gardner and I hear too, is, that we need support for the child care providers as well as we go forward. And this is a great way that's happening.
Commissioner Gardner.
Thank you, Mr. Chair. I just had a question that just came to my mind. So you're doing this work, Randy, for those 4. We just received news last week of grant funding coming from DEED for 2 new child care centers. Actually, one child care center over in Atwater, and then another one up at Prairie Woods. And is that something that's going to land on your plate as well, do you suppose?
Well, there's the potential for that. I mean, they certainly would need to reach out to us and we would look at that and look at our capacity to add more and then, get a contract between us and them. But there's certainly a possibility of that. We aren't involved in every daycare center in the county. Some have other avenues for consults, but.
Okay, and I guess
Absolutely.
that's a clarification I was looking for too, was does it have to be a certain size before they need a consultant like yourselves, or is this?
No, I think any daycare center.
So even an in, or a center, or does this affect in-home as well?
It does not.
Okay, all right, thank you. Oh,
Yeah, so we'll step in for Constance in Constance's absence and give the other side of the child.
So before you leave though, I had a similar line of questions regarding, because there's a lot of other daycares that we're aware of. So they reach out to you and ask for these consulting services.
Yeah.
And there is a fee attached to this?
Yeah, sorry, I didn't mention that. Yes, we charge our hourly fee that is renewed every year here at the board. Currently, it's $60 an hour.
Okay. And so these public daycare, it's public health. So it's not mandated, it's just so that they can help stay in alignment with the requirements of running a daycare, right? Because you're not actually checking the license to make sure that they're following.
No, we don't.
You don't
license
enforce,
them.
you're
Right, we
you're not
are-
enforcing, you're consulting.
But they are required to have a consultant, that's in statute,
Okay.
yes. But we don't have anything to do with their licensing, we're making sure.
And so
that
all
they're
public ones, but not private ones? Is that what I
Not
heard
the
you say?
in-home daycares, no.
Okay, they're not required, but they could have it
They'll
if they
talk about
wanted
that
to.
part.
So, okay, that's all I had too.
right.
Thanks for the clarification. Thanks for coming in.
Actually, good question.
So, on the in-home side of the other portion
Could
of
you-
our public, yep, so, good morning, I'm Caroline Kahn, I'm the Health and Human Services Director, stepping in for Constance Nelson, our Children's Services Supervisor, who was unable to be here this morning. So part of our daycare update for you this morning was including the public health nurse consultation portion, as well as we've invited Tammy DeVos to come and share a little bit about how in-home licensing works from the county perspective. So public health helps support our daycare centers, which are licensed outside of the county by the state, and then we also help facilitate licensing for in-home. So I've invited Tammy to introduce herself as well and share a little bit about her role in supporting childcare locally.
Welcome.
Hi, my name is Tammy DeVos. I am the family childcare licensor for the county. I'm kind of the first contact homes come to when they want to become licensed. And a license is required when you care for more than one unrelated family. That's what the state statute says. So you can, if you're caring for relatives like nieces, nephews, and grandchildren, you don't need a license. Anyone beyond that, you do. Currently, we have 81 licensed homes. I do orientations for new applicants and then do the home inspections for them. I initiate a fire inspection if it's required by statute and just help them tick all the boxes that they need to have a safe and productive home for the families that they serve. So, and then I also support them. I get a lot of questions every day and I know we do a lot of variances regarding capacity and to a certain extent, but just to maintain, as long as there's safety, that's their first requirement, so. Oh, yeah, ongoing, I do annual visits, and their license right now usually lasts 2 years. Coming next year, there'll be annual licenses, but we're required to visit them at least once a year and to make sure that they're following all the guidelines from the state, so.
And in this case, are you the governing authority?
Well,
For the-
DHS
for the
is the
in-
governing
for the
authority.
in-home?
Yep, but I am the person that goes out for DHS.
And so if there's a violation, it's
Then I do
on
a
you to
correction
have
order
to
or
do the
fix the
correction?
ticket. Yep.
Okay, thank you. Commissioner Gardner?
Thank you, Mr. Chair. Tammy, welcome, and thank you for what you do. Couple of questions. The number of in-home providers, did I hear you say 84?
Yeah, we have 81 that are active right now.
Okay. And do you know, is that up a little bit from COVID or, because I know we've been really struggling with the in-home piece of this.
Right.
Yeah, because there's just so much that our in-home providers have to do in order to do this. And I know we've put a lot of help out there. I see Michelle Muratsky hiding back there this morning, and she's worked very heavily on childcare for Kandiyohi County and now also for the EDC as well. Do we have any possibility of growing those numbers? And the reason I ask is that we have a lot of folks who've been doing this for under 5 years, and a lot of folks have been doing this over 25 years. And if we start losing those providers, are we looking at a model where it's only going to be center-based at some point in time?
I would hope not. But I do get at least 5 inquiries a week. It's just a matter of hoping that they give the applications back to me. Because if there's not an application, I don't have the authority to go out to the homes or the locations to do to start the the businesses.
Do we provide any assistance to those folks in filling out applications? Or
Yes, we do, actually, through UCAP, there's our Wayfinder.
Uh-huh.
And so usually it's Tana Stuckey, but Michelle is here in her place, and they're wonderful. I mean, so we're kind of teaming with them, so I try to get them in the loop right away.
Okay.
But your, kind of a related question, your role is to answer questions, not to advocate, to try to encourage someone to get into the business other than to, when they contact you.
Well, I do give them information, and that's kind of part of the advocacy too, because because it's overwhelming. I mean, the rule now is overwhelming. So it's just to kind of help guide them and walk them slowly through it. So it's not something that you can open tomorrow, put an application in today and open tomorrow. It's something that takes, a couple months.
Right, but I mean, you wouldn't pick up the phone and say, call somebody and say, hey, I think you'd make a great daycare
Right,
provider. and-
right. That's what the Wayfinders role is,
Okay.
they help with the recruiting and advertising.
Thank you. Commissioner Bird.
Well, thank you, Mr. Chair. I remember 2 decades ago, the concerns about all the rules and regulations for childcare. And now I can just fathom how huge it must be. In somebody applying for a license, I often hear some things from other people, what are some concerns they may have. What are some of the major concerns you may be hearing, some of the rules and regulations to meet, or that could be a financial hardship or something, for example, background checks and things like that? And what does that cost? And
Well, right now, the Department of Human Services has taken away a lot of those fees.
Okay.
So right now, there's no application fee for a license. So all of our licensed providers this year and any new ones, this year and next year, there will not be a fee. DHS is covering that. And they're also covering background study fees this year, so through the end of the year.
Is that fairly new then, or?
It is.
Okay,
It is.
that's good.
This year, 2024 and 25, the licensing fees, but DHS has been covering background fees since COVID.
Good.
Yeah.
So a lot of times we hear in the community, whether it's issues regarding planning and zoning or other areas, maybe public works sometimes, about the county is making it really hard to do X, Y, Z. When in reality, the county doesn't have very much authority in a lot of those areas because they're either state mandated or federally mandated. Is there anything, maybe this is a little bit of a loaded question, but are there ways, without describing what they are there ways that we can talk about how we could make it easier as a county for people to become daycare providers?
Well, I think there are. I mean, sometimes if there's an issue, if there's a concern, like regarding a space in a house, just that space can't be used until it's brought up to code. So, there are providers out there that they want to use their basement, but they're just waiting for the grants to come through or for funding so they can replace windows to make them legal egress windows. So they just use a different space in their house. So it's not completely ruled out. They just can't use some spaces until they're available.
And your guidance is clearly a helpful thing to break down some of those barriers, but also along those lines, do we charge anything for considering an application? Is there an application fee
No,
to become a daycare provider?
right now there is not. So in the past, it's been $50 a year. So right now, the state is covering that fee, and that's a statewide fee.
But is that fee paid to the county?
It is paid to the county,
But by the state right now?
right?
Okay, thank you.
I think one other thing to note is that
You want to,
one other thing to note, that the work that they do is they provide provider meetings to help coach and mentor. Like you mentioned, that we have some really seasoned childcare providers in home, as well as some new ones, and creating an atmosphere and an opportunity for those individuals to come together and talk about different things and share education and ongoing updates and looking at things differently. I think fosters a very collaborative environment in Candy, Ojai County, as well as connecting with other partnerships, such as finding grants and working with the Wayfinder, as well as the EDC, and trying to take a collaborative approach to addressing some of our childcare needs locally. So I think I want to highlight that work, because that's evening work that she puts in and helps coordinate and put together to continue to support and foster some vibrant in-home options for our community.
Okay,
Mr.
thank
Chair,
you.
if I may.
Go ahead.
And thank you for your presentation and the work that you do. I think it's very educational. In a previous county, I went on a visit with the daycare licensure, and I would encourage, if you're open to it, or just to sit down with a commissioner, because the iPad that you take into the home, you're checking everything and anything. And it's not easy for the daycare provider to sit through that. It's really a home inspection, and you are getting critiqued on the temperature of your water heater, if the railing isn't high enough or low enough, what type of cribs are you using, all of those essentials. And so I think it's very important, the work that you do. I think we do a phenomenal job on outreach and providing that support, but I think the biggest misconception is all the centers are licensed by the state. That's why they have to have a consulting, and then they consult with the local public health, which is, kind of typical local state government working together. And then with the in-home license, we follow DHS rules, and we're at the mercy of DHS on that. And the rules have expanded over the years, as you probably know. But I think it is really intriguing and educational, especially it was for myself to sit through a licensing visit, because it's very in-depth. And, I think the daycare world has changed. I know with the EDC and the MMDC, we are trying to encourage individuals to look at it more as a business concept, because that is essentially what they are doing. And so I think that has changed and evolved over the years. And so that's where I think this collaboration is really important. I commend you both for doing it.
Yeah, Commissioner Gardner.
Thank you, Mr. Chair. And just to remind everybody, the county and this board has shown their support for both in-home and center-based childcare over the past 4 years or so, and we committed a good number of ARPA funds towards that as well. And just recently, we committed a little bit more for this most recent successful grant application to DEED as well. So that's going to amount to about, 65 or so seats between the two centers. And then we just, we need another whole bunch, because the need just grows. It doesn't stay static. So we've made a lot of progress. We'll have, over the past 4 years, created well over 300 childcare seats in Candido County, but we need, it's expensive to do that. And so we need to avail ourselves of any and all of the grant funding that's available for any place in the entire county. And so I appreciate the work that you do, appreciate the work that our economic development professionals do in this area, and the work continues.
So I just want to make a comment, because when either Administrator Baker or one of you said about the somewhat of a stress level when you come in to do that inspection, flashed me back to my days of milking cows when we had the grade A dairy inspections, and you knew the inspector was coming this week, and you're looking through your whole barn and milk room to make sure you had all the bases covered. It was stressful, and I'm sure it's stressful for them too. So thank you again for coming in and all the work that all our daycare providers do across the county
Yeah,
and
they're pretty
region.
amazing.
Thanks.
Great. Thank you.
All right. Next up, Children's Mental Health Screening Grant Update. Director Khan and Jolyn Sundstrom.
I was supposed to reject it. Good morning. As stated previously, I'm Caroline Kahn. I'm the Director of Health and Human Services for Candido County, and this is Jolyn Sundstrom, our Children's Services Manager. And this morning, we wanted to come and share a brief update on the Children's Mental Health Screening Grant and some ways that our team has work towards fostering some community conversations around mental health and continuing our dialogue in May as Mental Health Month. So would you like to start with the video, or do you start with?
Maybe I'll give some background really quick. So each year, Candiac County gets an allocation from the state to support screening children who enter the child protection and child welfare system. So every child that we work with in child protection has between the ages of 3 months and 18 years old, has a children's mental health screening done when they enter the system. So we use the pediatric symptom checklist or ages and stages questionnaire, similar to what they do at medical visits, or when public health meets with them, they also do some of that same thing. Corrections does mental health screening similar to this as well. And so with that, we get an allocation to do those screens, and if the child is above the screening threshold, we can refer them to mental health services and pay for some of those mental health services with some of those funds. Over the past 2 or 3 years, this allocation has become a lot more restrictive. DHS has changed it. We used to put a lot of the money towards our in-home mental health services, our in-home parenting education. And now they've changed that a lot, so you're not able to utilize the funds as we used to be able to put towards actual service. So we've had to shift our focus, which kind of leads to where we've gotten to now, is that we've worked really hard to reduce some of the stigma in our community. And so our funds have been utilized, still some for in-home services, although a lot less money than in the past. We have used the funds to support PACT 4 and their mental health pieces. We've also used the funds to support Kids Connection. I don't know if you guys know what Kids Connection was, but it was held at the mall in February, March, and April on every Tuesday. And it was geared for families to come out and be involved in a variety of different activities with the hopes that they're getting more connected to their community. We know that COVID isolated a lot of children and families, and so really trying to get those connections back for families. We know that people who feel more connected are more likely to reach out and seek the help that they need. So that kind of led to us led to another project with our leftover money. We happened to have some leftover money last year, which is rare. And so I was at our local collaborative talking about mental health, and we were all brainstorming different ideas for Mental Health Month. And one of the ideas that another county had brought up was that they had given water bottles to children. That was something that piqued my interest because in Candiac County, we've worked really hard to secure some grants to do trauma-based interventional services for children. So basically trying to adjust children's behaviors when they're coming into care or when they're moving in with foster parents, and really having a trauma-focused lens to that. And so some of that is connectedness, behavior modification types things, and really focusing on their attachment. One of the huge pieces that training focused on is that most kids who come into the system are malnourished and they are dehydrated. And when they are dehydrated and malnourished, their body's not functioning very well and they lose their ability to regulate, which is why we see a lot of behaviors coming out of them. In that training, they talked about even just 10% of dehydration in your body causes your brain to start shutting down and not functioning very well. And so if you think about by the time you're thirsty, you're already well over 10% being dehydrated. So it was just very interesting, which is where the water cup concept came from, of how do we get people more hydrated, but then also how do we get students in our schools more involved in mental health and reducing the stigma. So with that.
With that, we are going to show you the premiere of a mental health video that talks about our Tumblr project, a little bit about its origin, and then talk a little bit about that distribution. So we're going to hope this text sound works.
The grant we've
had for several years. Over time, it's kind of changed how we can utilize the funds and what services we can put them towards or not. So something that we thought we could do in this grant was to do more community outreach and education to reduce the stigma of mental health. During COVID, there was a lot of kids that developed anxiety and depression from being home and isolated, not having the right supports, kids missing out on those pieces and then not sure how to get back to some of that after COVID. Children in general are often not receiving the right nutrition or enough water per day. By the time you're thirsty, your brain is already 10% down from working. So you're not paying as good of attention. You can't transition well from one thing to another. You might feel a little bit anxious. Your body starts to feel stressed when you don't have enough liquid in you and you're not hydrated. And so that has always kind of stuck with me. We were just talking about different ideas for Mental Health Month because May is Mental Health Month. And so one school had talked about that they had done water bottles, and that kind of struck me as something to do for children, but not just a water bottle that was this plastic thing that was going to get thrown in a cupboard. Some kids feel left out because they don't have their Stanley, and these other kids all walk around with their Stanleys clunking around all day. And so having something similar for everyone, looking at that mental health aspect. And then as a group, we met here with our public health, other supervisors in our mental health area, and came up with the idea of having schools and students actually design these and put their own stamp on it so that they've had some ability to look at the stigma and think about that. Everyone in the high school will have one of these if they so choose. And so to feel that togetherness and that support that, hey, everybody has this mug, versus just giving it to people who maybe we know have mental health issues, that creates a different stigma about mental health and maybe embarrassment to carry around. So all students carrying it, I think, is just kind of a cool way to come together and support each other. And also just for everyone to be aware they can reach out if they need help. And then going bigger, when they bring those home, parents will ask about them. What does that mean? Why did they get them? And that will create more conversation amongst people in our county. If kids from other schools are at sporting events and have their cups, or they're at other activities and they're like, oh, that's how they designed it, maybe it will create that conversation amongst them too and create some connection that might not have otherwise happened.
So that will be a video that we'll be able to share from our Candy Ojai County pages, as well as each school. How we facilitated this was we partnered with 1017 Media to help us facilitate. We don't have the capacity to go meet with all the schools, meet with all the school council members, coordinate distribution. So we really were able to work with that local partnership to help make that possible and work with the student councils to come up with their student design, as well as what color. They had their color choices. I was surprised that even Wilmer didn't choose red. So in getting those out and then creating a video for that school specifically that featured their brand colors and their mugs as well, to share and launch with this, and in the efforts to create that community conversation and break down the stigma, as well as keeping that 988 number available and ready in the hands of students from 9th through 12th grade. So if you watch, I don't have one of their videos up. As I was watching this one, I realized I probably should have had one, but ACGC had shared theirs recently, and it's already up to 42 shares socially in supporting those community conversations around mental health. I know the distribution in New London Spicer was I think that was our first one, and a very positive reaction. I had the opportunity to talk to a teacher from that school, and she was just amazed by the positive impact from the students, and the softball team was excited to bring their mugs to their next game and utilize that, and really just keep creating and continuing those conversations and being open about mental health, care and reaching out for support. So wanted to come this morning to share about this community project, and that hopefully you'll see these mugs, as they continue out to get into the hands of students that and students that you see at grocery stores and the pool this summer. Hopefully we continue to see them and continue that conversation forward.
Any questions? What kind of innovative work did you guys
Well,
use?
just a comment. I'm glad to hear about all the collaboration too with Pack for Families and the schools and all the other agencies you're working with. And I think it's really fantastic that we work together like that and doing good things like this. Great.
Yeah, I think we've been fortunate to have a good partnership also with public health, doing some outreach in
Absolutely.
the mental health arena as well. In addition to just doing these cups, we also have done some bags for foster children. We also have a stand by the exit of our employee entrance that staff can take items out like fidgets and stress reducing toys, things like that, to people that they know are having difficulty. Just, I think the outreach has been tremendous in our agency, and our partnership with public health has been very much appreciated as well.
And Mr. Chair, may I follow up? One other comment too is that this is an area of prevention we're looking at here too. And often we don't get a chance to do that. So that is just fantastic that it will work that in and that works out well.
Yeah, and it seems like a sort of ambitious undertaking. How many of those did you distribute? I mean, to K through 12 or just?
9 through 12. 9 through 12.
9 through
But now
12.
the eighth graders are wondering when they get
Oh,
theirs.
that was my next question is it going to be sustainable? So every year you need to add the next class that comes in.
You know, this was a unique opportunity that we had, and we looked at it as a once-in-a-lifetime chance.
Yep.
If that funding is available in the future, I think it might be something that we would look at continuing. But right now, if there was, say, a student transferred out from the order time to when received, we've asked that they get returned to the guidance counselor to get redistributed to future students. But I don't have the crystal ball of state funding or grant funding. But I think it's been a really positive opportunity to take when we had the chance versus not utilizing that grant to its full potential. So not currently planned for a sustainable project, but proud project to be a part of and watch roll out as we've had the chance this past year. So.
Thank you. Commissioner Dale Anderson.
I just think it's a great thing because, I mean, I got grandkids and, you know, whether you want to think it's a big deal or not, that kind of water bottle that they have is a big deal. So the fact that you could give it to everybody, I think that equals the playing field a lot and makes it an important thing because it is amazing to me. Well, I can't have that water bottle. It isn't the right water bottle to have in school. So I think it's a big deal, and the fact that you guys could do this is really a great thing.
Yeah, I struggled for a styrofoam cup, just so you know. All right, well, thank you very much for your presentation.
Thanks.
Sounds like cowbells leaving.
I can't remember where I put my water cup. Probably rolling around under the seat of my pickup. All right. Next up, Corey Smith.
All right. Good morning, Mr. Chair, members of the board. Corey Smith, the director out at Glacial Lake Sanitary Sewer and Water District. I'm here before you today for our wastewater treatment plant Phase 2 project retainage. In the past, during a project, usually 5% of the project is withheld off of the pay app. Now, after new legislation has been passed, the contractors have the option to choose to do it that typical way where you keep the 5% retainage, or now they have the ability to pledge a bond or security as the retainage. So how does this work? In this case, Gritter was the contractor, and that's the route that they choose was to pledge securities or pledge a bond. So Gritter will put 5% of the dollar amount of the completed work into the securities fund. This account is Candiwai County's account and Gritter's account as well. So anything that has to do with moving the money, we both have to sign off on that. Our engineer, Bolton and Mink, will be responsible at all times for making sure that there is 5% in there of the completed work. Basically, once the project is complete, both parties will need to sign off before the money is released. So typically for retainage, we do not bring anything to the county board for this. We usually don't come back here unless it's a change order or final pay app. But this is a new option that we wanted you guys to be aware of moving forward because you might see it in other projects. It's just something that we wanted to inform you about. So at the Glacial Lakes Commission meeting last night, they recommended forwarding this to the county board for consideration. So with that, it is Glacial Lakes Commission's recommendation to allow the administrator to sign on behalf of the county.
So you heard the recommendation from staff to provide authority to let the administrator sign on behalf of the county. I'd entertain a motion to that effect.
Mr. Chair, I'll make the motion to allow the administrator to sign on behalf of the county
For the
for the Glacial Lakes Phase
Retainer
2,
agreement,
yeah,
yes.
retainage.
thank you. Do I hear a second?
I'll second.
Commissioner Gardner seconds. Any discussion? Any questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thanks for coming in, Corey. We're going to do two more if you guys can handle it, and then we'll take a short break. So next up, nuisance abatement. Gary.
Thank you, Mr. Chairman, and this is, my name is Gary Gear with the Candido County Environmental Services Department, and I do have a nuisance abatement item for your action this morning. The address is 4077 15th Street Northeast, just about a mile and a half northwest of where we are standing, so just off of the north side of Swan Lake. The property owner was sent a letter on April 10th requesting that the nuisance be abated by May 10th. And on May 13th, a site visit had verified that the property owner had not taken any action yet and was expressed a little bit of inability due to soil moisture conditions, but there's a lot of items that are certainly would have been achievable to be working towards. So in having visited with him and explained the process to him, that then I would then, following that inspection, send a follow-up letter and schedule this hearing. And so that is what I am here before you this morning on. It was on May 15th that second letter was sent scheduling this abatement hearing. Staff would be recommending that the board pass a motion directing staff to abate the nuisance by June 21st. It would be giving them 30 days with all abatement costs incurred by the county charged against the property as a special assessment, and that is the normal nuisance ordinance procedures. So with that, that's staff's input.
So you've heard the recommendation of staff to enforce the abatement. How do you wish to proceed?
Mr. Chair, I'll move the recommendation of staff.
Commissioner Gardner makes a motion to approve the abatement. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any questions or comments? Commissioner Dale Anderson.
So it's a big chunk of property, Gary. How much of this does he have to get off of it? I mean, is there a percentage that has to disappear, or is it all got to be gone, or what's the?
The aerial photo that was within the file shows a lot of items. Primarily, it's the unlicensed vehicles, and it would be all of the unlicensed vehicles. I know there's a stockpile that's a little hard to see. It's well, you're not able to see here, of tires as well. So that's what I meant by some miscellaneous solid waste items that would need to go too. But primarily, it's the unlicensed vehicles.
Okay.
This is a property that this office has dealt with for over 20 years now. He does do an automobile repair business there, and he, at his own admission, and I don't want to, in speaking with him on his property, I don't want to misspeak. He's not here, but he says, "Oh, I just hang on to things too long." So we're kind of here bumping him along, helping him along. I would anticipate. I've worked with him in the past. I'm anticipating that he will come to compliance before we would go in and clean this up, because that has been he just needs a bump every once in a while, but this is our process.
Okay, thanks.
And just as a clarification, I believe we have an ordinance that allows a certain number, it's not very many, unlicensed vehicles, or maybe none, I'm not sure.
We do, and it is in the nuisance ordinance, but that's in the agricultural zones, and it does allow 3. So this is a residential zone because of the proximity to Swan Lake there, within 1,000 feet. So then there's no unlicensed vehicles are allowed in a residential zone.
Okay, thank you. Any,
And then I'll go.
Commissioner Gardner?
No, I don't.
Thank you, Mr. Chair. Gary, This is in a residential zone, so was there a conditional use permit that was issued for this?
There is a conditional use permit for the property back in the mid-90s was originally issued. He is not in the violation of the conditions of his conditional use permit, but he is in violation, because, you know, a conditional use permit can have specific conditions. So he's meeting those. He's not compliant with the nuisance ordinance as to the number of unlicensed vehicles on this.
So the findings and conditions that were issued when that conditional use permit was issued, he's not in violation of those?
Correct. He's, let me just read those. He can operate an auto body repair shop, no more than 3 vehicles shown at a time for sale. He's got a row of 3 for sale, and discarded parts screened. He has an area behind his garage that he has kind of designated over the years as where he keeps the parts that he may be using again. So they're behind the buildings, they're in a wooded area, not to be seen from any public right-of-way. And then, rugs to be shown off premises. It was also a carpet business or a linoleum lane business that he had at that time, which he no longer does. But, so that's why I say he's compliant with the conditions of the conditional use permit, but unlicensed vehicles are what we're looking at today, I believe.
It just seems odd to me. I think today we probably would have covered the subject of excess vehicles on the property.
I believe so.
In the way that we do it now. But as it was issued back in the 90s, he's not in violation of the CUP.
Correct.
Okay, thank you.
Mr. Chair, just a quick question about the location. Did somebody use a drone to get this picture then?
No, this is just our pictometry aerial photography.
Oh.
So it's, and having worked with the property multiple times, I guess I didn't go across the property with him. I went to the site, visited with him, and didn't take new photos again because I knew I had this. I had this before I went out there, so.
I think I know where that property is at. So on the right hand of the screen is where there's a road there, right? That we can't see.
Well,
I'm trying to figure out where this property is, because I've been by there.
15th Street is on the left side of this photo.
Okay.
And Highway 71 is on the east side, or the right side of the photo, you know,
Okay.
a half a mile plus, but.
All right, any other questions or comments?
One other question.
Go ahead.
Any complaints from the neighbors about this, or?
That's where this
This
was
is where it
initiated.
started. I
correct.
assumed that, but.
Yes. Yeah.
I can see why.
All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
All right, thank you all.
All right, before we take a break, Dr. King?
Good morning. My name is Otis King. I'm the Director of Emergency Management here in Kennesaw County. And today I am coming for an appointment letter for the Central Minnesota Emergency Services Board appointment to Emergency Management Advisory Committee. Basically, it's just some paperwork to wrap up some of the roles and responsibilities for myself. A little bit of information on that committee. It coordinates planning, training, and the purchase and use of equipment to ensure the most effective response to emergencies, both natural and otherwise, within this region, which is Region 4 for Minnesota.
So you heard the recommendation of staff. What do you wish to act? Commissioner Berg?
Mr. Chair, I so move that Dr. King be appointed by the board to this Emergency Management Advisory Committee.
We have a motion on the floor. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any other comments or questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. If you want to leave that with us, we'll get it signed and we'll get it back to you
Absolutely, sir.
after the meeting. Thank you. What's that?
We have copies.
Okay. Thank you for coming in. We will take a 5-minute recess. Kaneohe County Board of Commissioners meeting. Next up, a request to repurchase the tax forfeited property by the previous owner. Michelle?
Good morning, Chairman and members of the board. I'm here again with another,
For the people
oh,
listening.
I'm sorry, Michelle Hanson from the Auditor Treasurer's Office.
Thank you.
Here again with another request from a previous owner to repurchase the tax forfeited property. I had sent out in your packet, I believe, the letter of request and the premise or the issue as to why the taxes were unpaid. And the request from the previous owner that they would like to make a payment in June and July now and get those taken care of to repurchase the property. So today I'm here to request your approval to allow them to repurchase as we've done in the past.
Thank you. So you heard Ms. Hanson's request regarding the, I assume it's a staff recommendation to consider the request by the owners of the tax forfeited property to repurchase the property. How do you wish to proceed?
Mr. Chair,
Commissioner Andrew.
I'd like to make a motion to approve the repurchase of the property by the previous owner.
So we have a motion on the floor. Do I hear a second?
I'll second it.
Commissioner Dale Anderson seconds. Any questions or comments? I just have one, maybe two. A lot of times we allow them a scheduled payment because I think they want to put this property on the market.
Correct.
We're going to clear this up within a calendar year or less, right?
Correct, yes.
Okay, all right,
Yep, that is their intent.
okay. All right, any other questions or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Well, I think this is the right thing to do, given the tax forfeiture business that just took place in the legislature. I know it's the right thing to do whenever we can to get these back in the hands of the owners. So,
Correct.
Thank you
Thank
for
you.
coming in. Up next, Resolution 2024-16, authorizing a MnDOT agreement. Mr. Odens.
Yeah, Mr. Chair, members of the board, I'm Mel Odens, Public Works Director, Kaneohe County. Before you is a resolution authorizing the county to enter into an agreement with the state to replace a railroad crossing. It would be on First Avenue, our old County Road 55, in the vicinity of the Pels and Farm Service Elevator area. This was one of the original projects within the Wilmer Y, and it was inadvertently overlooked, so it was added to the punch list for the project. And so it took a few years, and a few years down the road, it got even worse. So basically, the crossing is coned off, and you have to drive on the shoulders around it. It's not in good condition. But we did get it resolved. We got an agreement put together. Burlington Northern is going to be doing the work starting as soon as maybe next Monday or the next. Everybody recognizes that it needs done. So it's my recommendation to enter into this agreement and recommend the chair and the administrator sign the resolution on behalf of the county. And then it also authorizes me to sign the corresponding payments and requests or agreements. So it's my recommendation for that, Mr. Chair, and our portion of the project financial impact is 10%, which has been 10%, which has been included in the Wilmer Y master agreement. So this is not new money. And so our exposure would be, at this time, estimated to be $15,973.30.
So you've heard recommendation for staff. How do you wish to proceed?
Mr. Chair, I so move for resolution.
Commissioner Berg moves on Resolution 2024-16. Do I hear a second?
I'll second it.
Commissioner Dale Anderson seconds. Any questions or comments?
I'll make a comment. This is great that you're going to do this, Mel, because I mean, I can't imagine when I used to drive feedloads out of there that it's really serious. I mean, we go in there with a corn load and I cringe when I go around the cones. So this will be a great project to get done for everybody to have a little safer drive there.
Yeah, thank you. We've had some issues with tires punctured and
So I think in your comments, and maybe you didn't mean to say that, but I think in your opening comments, you said formerly County Road 55. Has that been renamed or has it been turned back to the city?
So when this crossing is completed, it will turn over to First Avenue. We'll do a system revision for the city of Walmer. So in the whole matrix of system revisions for this, anything north of Highway 12 will no longer be county-owned road systems. It'll be the city of Wilmer and Wilmer Township.
And so you call it system revisions as opposed to turnbacks? Is that just because it's part of the Wilmer
Correct.
Y project?
It's the same.
Same.
It will be a turn back via a system revision. We'll do a system revision and it will turn back to the city.
And so the costs, when we turn back or do a revision, we usually turn them back in nice condition.
Right, it was redone.
Yep. And so, who currently, besides the county's 15,000, and I think you mentioned BNSF, does the state have any
Yes,
payment in this? And does
correct.
the city?
The state would fund the lion's share of it. I think theirs is the 90%. Burlington Northern's gonna do the work, because that's how we work with doing railroad crossings. And then there's a 10% local share.
And
Now-
does BNSF get paid for that work?
Yeah, correct. And now, the thing that we also do is we patch the little, outside the ballast, we patch that, and then we also provide some traffic control signs. That's not included in this, but we do that on all railroad crossings, so.
But the city will have no cost, but then going forward, it's theirs to
That is correct.
own and maintain.
Yep,
Okay,
yep.
thank you for that clarification. Any other questions? Hearing none, all in favor signify by saying aye.
Aye.
Both same sign. Motion carries. Thank you. All right, we have a planning condition recommendation from zoning administrator Van Dyken.
Thank you, Mr. Chair, members of the board. Eric Van Dyken, County Zoning Administrator, before you today with one approval request, action item based on the Planning Commission meeting last Monday, May 13th. It was a pretty low-key meeting, went fairly quickly. There's one request from Central Specialties for a conditional use permit for a gravel mine in Roseville Township. This is a renewal. Our ordinance has timelines for gravel pits of 10 years for pits that are up to 40 acres, and once we get over 40, they get 30-year permits. So we kind of went through its first 10-year permitting period, and it's up for a renewal. History, the record shows that they've been operating well there. We've had no complaints, we've had no problems, no concerns coming from this pit, and that was then reflected in the hearing that the township and citizenry did not show up with concerns. So it was recommended for approval or reapproval, as it were, from the Planning Commission. The same conditions are proposed 1 through 9 as were originally assigned to this permit, and the findings as you see in the draft minutes.
So you heard the recommendation from staff regarding the zoning application. How do you wish to proceed?
Mr. Chair, I'll make a motion to approve the permit request as recommended by the Planning and Zoning Commission with the conditions and findings as recorded.
Thank you. I have a motion on the floor. Do I hear a second?
I'll second.
Commissioner Gardner seconds. Any questions or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
Thank you. Next up is consideration for going into a closed session. So under Minnesota State statute, we're going into closed session under Minnesota State Statute 13D.05 subdivision 3 regarding the discussion of real property. This is in regard to the county courthouse. No other county buildings will be discussed at this time. And we'll go into this closed session, should you approve going into the closed session, which is the consideration right now on the floor. We'll go into that closed session after we are finished with report outs. Or should we not adjourn and go into session? And
You
then-
can't adjourn because you'd be
Okay.
close the meeting.
All right, thanks for that clarification.
And you have to have a motion to go into closed session.
Okay, and that's what I'm asking for now is a motion, but my question is, This is going to be a closed session, so everybody will have to leave the room, with the exception of most of us on the dais. But then we haven't done our reports yet.
We come back out of closed
Okay.
session.
So then the press has to hang around if they want to be part of the.
You can do the
It's up to them.
Okay. All right, well, I'd entertain a motion for going into closed session.
So move.
Commissioner Gardner moves on the closed session request. Do I hear a second?
I'll second it.
Mr. Dale Anderson seconds. Any questions or, no, all in favor signify by saying aye.
Aye.
Oh, same sign? Motion
I'm gonna
carries.
go, I'm gonna go. See if water's running down now.
Go ahead, put a water bottle.
I need a drink.
Well, yeah, maybe. Don't forget your coffee and your keys.
come
That would be worse.
Smash my
Either
face
that or
against
they
the
can
window.
watch your
Taking a
video.
break now, or are we
Do
gonna?
you want a break?
Well, I don't know. Are we taking a break, or are we gonna just?
No, I'm just gonna
Oh,
talk
okay.
to them and then shut the door.
Okay, all right.
What's that?
This will need to be recorded.
Right. She can talk to the guys in the. Changes. Does Melissa have to leave also?
No, no.
You'll want that in the minutes, saying specifically, the motion approved. Courthouse and county.
Oh, cool.
That way it'll be clear on the record. It'll be-